Hi, I'm creating this video for the hopes that this video can be used for other people to kind of provide a guide, or could be used by medical professionals as a use case scenario of my personal journey with bilateral optic neuritis. In this video, I want to discuss exactly what has happened to me in the past 5 months and kind of give a step-by-step of what happened in terms of the different diagnoses that I encountered as I went through this process and try to figure out where I am today and where I'm going to be headed in the next couple weeks, months, or possibly years. So to begin with, on September 26th of last year, I woke up in the morning on a Sunday morning and I noticed that on my inferior nasal portion of my left eye, I saw that it was a little bit foggy. I noticed in the morning that at first I thought it was just crud in my eye. And what I realized is that it wasn't. It was this fuzziness that just or fogginess that kind of glazed over, and it kind of just stayed there for a little bit. I kind of went through my daily routine, not really thinking that much about it. And then unfortunately, I started noticing that it started creeping up closer and closer to my center point of vision. I started getting a little bit concerned. Being a Sunday evening, it's difficult to get medical treatment. I didn't want to go to the ER, so I said I'm going to go ahead and sleep on it. And I was hoping that it wasn't not a detached retina, because some of my friends have had a detached retina. They've kind of told me the symptoms, and I was concerned that maybe that's what it was. So on the Monday morning when I woke up, my left eye was in a lot of pain. It hurt to move my eye up, down, left, right, all directions. Everything in my left eye was just blurry, hypersensitive to light. When I would look at text, black and white text, or even text on my cell phone, it was kind of like really contrasty, really hard to make out the words compared to my right eye. So I kind of panicked, and I was able to get an ophthalmologist appointment the same day, that morning, and I got checked out by a really good ophthalmologist, and he told me that I had a swollen optic disc, and which was indicative of optic neuropathy in my left eye. Being at that point, I was trying to figure out, well, what could cause it. Understand that optic neuritis is a symptom, not an underlying cause of an issue. We ran through a whole litany of blood tests, the usual suspects: Lyme disease, syphilis, ANA for antibodies, lupus. We also scheduled an MRI to see if it was possibly multiple sclerosis, because optic neuritis is usually the first symptom of MS, which kind of made me really concerned. But the other thing that I had discussed with my ophthalmologist at the time was the fact that I was freely engaging in freediving, and I was doing it quite a lot. And the day before I started having the symptoms, I went down really, really deep, about probably 30-40 meters deep. And the consensus at that time, after a lot of my blood labs became negative, was that it was probably just compressive bariotrauma on my left eye, which I kind of told myself that, okay, I did something stupid, it'll probably heal, and I'm not going to do it again. It was just a one-time thing. So the week progressed, my left eye got a little better, and then on the following Monday, I woke up and my right eye was just same thing like my left eye. A lot of pain, very contrasty. It was actually still better in my left eye, but it was not 100% normal. So I went to go see the ophthalmologist again, same day appointment, and he looked at my right eye and said, "Yep, now your right optic disc is swollen." And my right optic disc looked just as swollen as it was the week prior in my left eye. Also, my left eye swelling had gone back to normal, and which kind of knocked out the whole bariotrauma theory out. So at that point, I decided to go ahead and just do the MRI as quickly as possible. And we ran a couple additional blood tests, which is mostly around some obscure viral or bacterial causes, like cat scratch fever and such, just to rule out possible viral infections and bacterial infections. So that was in the beginning of October, October 5th, and I ended up having an MRI. My MRI was completely normal, so I was very relieved. When I had my follow-up appointment in November, a month later, my right eye was 100% back to normal. Both my visual fields were 98%, and my left eye was at still about 60%. Back in October, it was down to 45%. I really wish at that time, and this is kind of a good point for anybody who goes through optic neuritis, is that after 4 weeks, you should probably get an OCT exam, OCT scan. And what that does is it uses infrared light to measure your retinal fiber layer thickness. Just as a general guide, a healthy individual has an average retinal fiber thickness of about 80 nanometers. Mine was, well, at the time I didn't know what it was, but what's really important is that 1 month after you have optic neuritis, you should get it scanned because that will create a baseline. And the reason being is that it takes about 20 weeks after your incident of optic neuritis for your retinal fiber layer to actually get to a point where it's going to be stable. So basically, once you have optic neuritis at first, it's your retinal fiber layer is a little bit swollen, which is why they don't do an OCT at the time that you're having optic neuritis. But about a month later, you want to get that scan to see kind of where you started, because about 20 weeks, in over 20 weeks, every person will have a decline. Decline will vary, but you will definitely see a change, and that change takes about 20 weeks for it to play out. So at that time, my right eye was 100%. My left eye again was about had gone from 45 to 60%. Really, the only downsides I had was I had a little bit of sensitivity in my left eye. My field of vision center and all the parts that were not affected by visual field were 100% normal. Just kind of an FYI, there's optic neuritis can affect you in 4 different ways. It can affect you with visual acuity, that's 20/20 vision. When it started, my left eye was 20/50, my right eye was 20/20. In October, when I had it on my right eye went bad to about 20/40, my left eye was 20/40, and by November it was back to 20/30 and 20/20, my right eye. The second thing that affects you is field of vision, and field of vision is directly related to your retinal fiber layer, and that's something where you can have blind spots. So in my case, I had no peripheral vision in my left eye; it was completely all gone and blurry, and I had no vision in the lower left-hand corner of my eye towards my nose, and that also. Fortunately, because my right eye was 100%, everything on this side of my eye, close to my nose, was 100% covered by my right eye. So my net result with both eyes is just I couldn't see out of my left. And I felt that at that time, I can live with it. I can deal with it. Let's just, hope that it's going to get better over 3 months. I didn't really have any second thought. I did have a thought in the back of my head is we still never really found what the root cause was. But at least everything was okay. Everything seemed to be stable. So I just kind of went in with my life. So, 3 months later, holidays came and went, and I had my, third 3-month follow-up visit in February 10th of this year. And at the time when they looked, that's when they did an OCT for the first time, and my OCT showed that in almost every sector except for the superior sectors, they were in the red, which basically means that the retinal fiber layer was below 60 nanometers. I didn't really pay attention or record exactly how much in the red it was, if it was just borderline between red and yellow being between 60 nanometers and 80 nanometers, but I don't know how badly it was in this, in the red. So some people I know can get such severe damage, it can go to, in the teens, which means that you have hardly any nerve axons left. If you are closer up to the 60 nanometer level, you still have a good amount of function left. It just kind of depends. So at the time, again, I was really upset because I know that you can never get that back. Once the retinal fiber layer is thinned out, it's never going to come back, and from a natural process. mainly because as humans, we just don't have the ability to regenerate that retinal fiber layer, um, because we don't have the molecular mechanisms to do so. Um, about after that point, I went home and I noticed that in my right eye, the visual field had kind of decreased from 96% down to 88%. My left eye had also decreased from 60% down to about 44%. I had just assumed that when I had my visual field checked in November, I had some issues with the visual testing machine, and I thought that because I could see a little bit with my right eye when I was testing my left eye, it was kind of giving a greater than I really had a result, which could result in why I got a 60% visual field. About 4 days later on Valentine's Day, I woke up with really, really bad eye pain in both eyes. It got to the point by the evening, I just was in a lot of pain. The next morning I woke up and both eyes were really, really bad in terms of contrast and blurriness. So I had another appointment. I went to go see the ophthalmologist and he took a look and he didn't see any evidence of optic swelling. I was concerned at that point that I felt like I needed steroids. And read that the part of the ONTT, the optic neuritis treatment plan, is to give IV steroids for 4 days, followed by a progesterone or steroid pills for about a week or two, just to kind of reduce the get rid of the acute phase. It reduces swelling, reduces inflammation, and it helps recover your vision. Most doctors that I understand, the reason why I was not prescribed steroids the last time and then on Valentine's Day was because that my visual acuity was still better than 20/50 at that time, and there was no evidence of optic swelling or optic neuritis at that time. It was possible I could have had demyelinization in my optic nerve, but there wasn't a way to visually inspect that through through my ophthalmologist's light exam. So at that point in time, we decided to order a whole bunch more blood tests. I'm going to go ahead and put a list of all the blood tests done at that time. And as the days had progressed, during between that weekend before Valentine's Day and the weekend after, my vision just got getting progressively worse. My left eye got to a point where everything looked hyperreal. My right eye, I started noticing a blind spot to the left and a little below of my right eye, as well as a little blind spot to the right of my eye, and that was affecting my overall field of vision. I started getting to this whole emotional roller coaster with thinking, oh my God, I'm losing my vision. Am I going to go blind? I keep telling myself only 2% of people who have optic neuritis goes blind. I try to have perspective that I know that some people get optic neuritis, they get it so bad that it's like 2200 or there's no light perception, and try to have at least some perspective on, I can still see, I can still drive, I can still do my job, but what I had in my mind, what was going on in my mind at the time was the fact that, would I be able to do my job? Would I be able to continue to drive? I don't know what I'm going to be like, what my vision would be like in weeks, months, years, etc. So we had about 18 blood tests that were done, and the hope was that it would reveal, either some type of nutritional issue, autoimmune. We ran through a whole vasculitis was being tested. I tested for anterior ischemic optic neuropathy, as well as non-ischemic optic neuropathy, which is basically, I think that's a test would be like C-reactive protein and ACE, just to see if there's inflammation in the blood vessels that could cause it. After about during those next couple of weeks, it was in February, it was kind of excruciating because I was waiting to get all the blood results, just trying to figure out what's causing this. I felt like there was this sense of urgency, because I felt like until I can figure out what's causing this, I can't stop what's happening. About a couple weeks later in February, when I started getting all of the blood tests negative, I did a bunch of research and found out that there were a couple of tests that were not performed. And I felt like, since at this point, I've now had reoccurring bioptic neuritis, that the usual suspects at that point in time is going to be essentially five potential disorders. One is called NMO, which is neuromyelitis optica spectrum disorder, NMOSD, and that is an autoimmune disease. Another one could potentially be is called MOG, which is myelin oligodendrite syndrome, and that's again an autoimmune where the body just removes the myelin sheaths. Essentially your antibodies just attacks your optic nerve and your retina. Another possibility is something called CRION, which is chronic reoccurring idiopathic optic neuropathy. And so there's really no way to test for that, but it's really a testing exclusion. So once you've been tested for everything and there's nothing left, generally you're going to be put into the CRION category. And again, CRION is considered an autoimmune disorder. Two other ones is called neoplastic optic neuropathy, and that is a kind of a form of a cancer where you can have small tumor cells, and there's a way to test for that, and there's a genetic testing called CRIP5. NMOSD can be tested by OCU4 antibody exam, blood test, and then MOD can be tested for anti-MOG syndrome. So there's an antibody as well as that blood test can be done. And lastly, there's another disease called scardiosis, which is a form of cancer. It's a small cell cancer, which can also cause this, and that can be detected with a PET scan. So right now at this point, I asked the doctor to go ahead and schedule those last exams, because I think at this point, since everything else has been tested, and the fact that people who do have bilateral optic neuritis tend to have one of these 5 things, I felt that I just need to get tested ASAP, because at least with all 5 of those possibilities, there's a form of treatment. And as soon as you get treatment, you can essentially prevent another relapse. Unfortunately, last week I had another attack of bilateral optic neuritis on Tuesday. And when I went to see the ophthalmologist last week to get a lot of these tests ordered, my right eye had, again, it was down 78%, so it went from 80 to 78% from a month ago, which was okay. My left eye went from 45% up to 60%, so that which was an improvement. And then my retinal fiber layer thickness was the same. So at least a week ago, I was in good spirits thinking, okay, things are getting better or staying the same. I'm going to figure out what this is. I want to get treatment. I think I'm going to be okay. And then, of course, I get another bout in the past week. And unfortunately, this has caused the blind spot in my right eye to get bigger. And it's actually getting really close to the center, which is because that's overlapping with my lack of visual field in my left eye. It's causing me to have extreme difficulty to read. I'm having extreme light sensitivity, so I can't even look at a computer screen right now. The good news is that I'm going to get the blood test results and the scan results hopefully by the end of next week or the week thereafter. So in about 2 weeks, I'll know exactly what's going to happen. I'm going to see a neuro-ophthalmologist this Wednesday, and I'm going to ask to get a VEP, or visual evoked potential exam. That's going to measure the amount of demyelinization of the optic nerve. I know that there is, for people who have moderate damage to the retinal fiber layer, people that have between 60 and 80, but have moderate myelin damage, there is a drug called 4AP, which is essentially a potassium channel blocker, and it's been able to show that it has significant benefit for people who've had this, had essentially moderate damage to the retinal fiber layer and moderate damage to their myelin sheaths in your optic nerve. At the end of the day, what I really hope is that I'll find out very quickly what's causing this. If in fact it is autoimmune, then it's possible I may may go into IV steroids, because it's still time to hopefully get some recovery. 2, the next thing that will probably happen is I'll get plasmapheresis, which is essentially where they filter your blood out. And then long term, I'll be put on, if it is one of these things, I'll be put onto a drug, one or a series of drugs, which effectively it's a immunosuppressant, and the goal of that is that it suppresses your immune system, so that way you don't produce the antibodies to cause another reoccurrence. And so I will provide an update in about 2 weeks to let everybody know who watches this video of what I ended up having. I really hope I will have an answer in about 2 weeks, and at least also my vision will get better in 2 weeks. But at least I hope that this video is used by anybody who experienced bilateral optic neuritis, and that way they can understand, what are the potential causes, and more importantly, what is the appropriate level of testing that you should get. So the moral of the story is, if you get bilateral optic neuritis, and even if your vision seems okay for the most part, and you don't know what the cause is, get an alkyporn 4 antibody test, get an anti-MOG antibody test, get a CRIP5 genetic testing, get a PET scan to see if he has cardiosis, and at least that will eliminate some of the obscure usual suspects that if someone were to get recurring optic neuritis, ahead of time, so that way you can start getting treatment to prevent yourself from losing any more vision at that point in time. So, kind of a recap, I hope that my vision is going to stay stable and get better. I don't know where this is going to turn out. This is, obviously I'm already in month 5 since this whole thing started, but end of month 1 of when things started getting really, really bad. And I hope that, as I make updates in 2 weeks, in a couple months, 6 months, a year, that I can kind of give people at least a good sense of what to expect, and what to kind of hope for, and in terms of a long-term prognosis with somebody who has bilateral optic neuritis. So I hope this video was informative, and I hope that if anybody has any questions, I'll put my contact information in this video, and they can feel free to reach out to me, and I'll be happy to answer any questions. So thank you very much for your time. Bye.